One lawyer who
Uh-huh.
came to me and so he did his health checkup and we found that his kidney reports were normal. He was losing protein in the urine. I recommended after all thorough workup that he needs a kidney biopsy. He was quite reluctant. उसका कहना था कि नहीं कि बाकी अदर गूगल है आजकल तो लोग गूगल पढ़ के आते हैं. So he said नहीं there are some other reason physiological reason से जिसके कारण मेरा प्रोटीन जा रहा है and he neglected.
So he didn't go for the
He didn't
biopsy.
go for the biopsy. Unfortunately, he met me after 6 months, and after that, he was on dialysis.
It gives me chills to think that one kidney biopsy would have saved
Yes.
him from getting a kidney transplant done. What's more concerning, a sudden rise in creatinine or a sudden decline in eGFR?
Sudden rise in creatinine is like a fire alarm. So we need to look at it differently, and it is an acute condition, and it may be reversible. Gradual fall in GFR, as we are discussing about the diabetic kidney disease,
which is eventual.
It happens slowly
Over an age.
and there are multiple factors that we need to address. So it's a chronic condition. First one is acute.
I mean, one symptom which should not go unnoticed of kidney damage in diabetes.
Protein in the urine, that is albuminuria.
A test which all diabetic patients should get for a healthy kidney.
A creatinine and urine protein creatinine, urine albumin creatinine ratio. These are the two tests they are must. Along with that, I will say BSL, your HbA1c, your sodium potassium micro and other tests are also. Creatinine to rise, almost 50% of the kidney function may be damaged. It is a silent disease. That's why it has got the more importance nowadays.
According to National Institute of Diabetes and Digestive and Kidney Diseases, 1 in 3 adults with diabetes has chronic kidney diseases, also known as diabetic kidney. If you or someone you care for is living with diabetes, chances are you are already watching blood sugar levels, managing your diet, and keeping up with the regular checkups. But how often do we pause to think about the kidneys? Those silent workhorses that quietly bear the brunt of chronic conditions, often without any early signs. In today's episode, we uncovered the standard tests that might not be enough and the early signs that you should be really tracking and how to control them before the silent damage becomes irreversible. Joining us today is Dr. Sachin Patil, a highly respected nephrologist based in Pune. With over 20 years of clinical experience, he has been at the forefront of kidney care, managing everything from chronic kidney diseases to hypertension, dialysis, and transplantation, which includes kidney transplant, liver and kidney transplants, kidney and pancreas transplants. His patient first approach, combined with deep commitment to education and prevention, makes him a trusted voice in the renal medicine department. We are honored to have him with us to shed light on the often overlooked connection between diabetes and healthy kidneys. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Sachin Patil. Hello, sir.
Namaste.
How are you?
I'm fine, ma'am.
Welcome to Sahyadri Health
Thank you.
Talks.
Thank you, Sahyadri and Tushita for giving me this opportunity to talk on this very important topic of diabetic kidney disease.
Yes, so diabetic kidney disease is something which we are going to talk about today. And we have heard so much when it comes to diabetes. Usually there are a lot of other parameters which are often, asked to keep in check. For instance, continuous glucose monitoring, check your insulin levels, and so much is spoken about it. But kidney health and diabetic kidney is something which is very, I think needs a lot of attention. So to begin with, what we understand here is diabetic kidney is a condition which happens in diabetic patients due to the higher blood sugar levels and the impact that it brings on the kidney. So if I have to ask you in a laymannish term, if you can just elaborate more on this.
See, why I chosen this topic basically is India is almost becoming the capital of the diabetes all over the world.
Yes.
And it is because of our day-to-day lifestyle problems and the sedentary lifestyle and maybe our bad food habits also, because of some junk foods, maybe excess salt in the diet. And we need to look into it, that why where our young generation also getting more hypertension and more diabetes.
Yeah.
And the incidence of CKD is also increasing. That is a chronic kidney disease,
Kidney disease.
the most common cause of this CKD, chronic kidney disease, kidney failure, is diabetes in India. And it's almost the incidence is 40 to 50%. तो मेरे पास जितने भी ओपीडी पेशेंट आते हैं, उसमें से मेजॉरिटी पेशेंट डायबिटीज ही होते हैं. तो जैसे सीकेडी का जो इंसिडेंस प्रिवेलेंस बोलते हैं 1 out of 10 ऑल ओवर द वर्ल्ड है, लेकिन मोमेंट आप 50-60 एज क्रॉस करते हो तो इंसिडेंस 1 in 5 हो जाता है। और
अच्छा।
सिंगल डायबिटिक पेशेंट अगर आप देते हो तो उसके अंदर 1 out of 3 पेशेंट्स को आपको किडनी प्रॉब्लम निकल सकती है।
ओके।
द मोस्ट इंपॉर्टेंट पार्ट ऑफ दिस treatment of kidney or any problem, any heart issue is costlier. Prevention is always better than cure, so we need to be aware, डायग्नोज भी होते
कि
हो
वहां
तो
तक
ट्रीट
पहुंचे
कैसे करें।
कैसे ना,
यस,
बेसिकली।
बहुत जरूरी
तो
है।
सर, इनके रिस्क फैक्टर्स क्या होते हैं? आर देयर एनी, आई मीन वी अंडरस्टैंड कि डायबिटीज इज वन मेजर कंट्रीब्यूटर, बट आल्सो द फैक्ट बीइंग कि नॉट एवरी डायबिटिक हैज अ किडनी इशू ना, सो व्हाट इज दिस डिफरेंस एंड व्हाई इट इज so is it more common in type 1 or type 2, or how is it?
See, just to describe type 1 and type 2,
हाँ जी।
just for our viewers, is that type 1 diabetes is like when you have got absolute insulin deficiency, and type 2 diabetes means insulin is resistance. So insulin resistance happens. So amount may be okay, but it is not working. So type 1 diabetes is like a, in such cases, what will happen that it's like a studious student and who is doing every all homework properly, but sometimes he slips in and his sugars get increased and that leads to complications.
अच्छा।
But for type 2 diabetes, it's like that you will be having multiple problems. Moment type 2 diabetes gets diagnosed, at that time you might be having, उस टाइम पे आपको ब्लड प्रेशर निकल सकता है, ओबेसिटी निकल सकती है, लिपिड प्रोफाइल डिरेंज हो सकता है। सो टाइप 2 डायबिटीज यूजुअली may not be diagnosed immediately. Sometimes it gets diagnosed when you get symptoms. So
या फिर एक्सीडेंटली जब
Yes.
हेल्थ चेक्स वगैरह में
यस
होता
यस
है।
यस 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 सो इसी के कारण मेरा मानना है कि टाइप 1 डायबिटीज में तो भी एटलीस्ट सिम्टम्स तुरंत आते हैं तो डायग्नोज होता है और वो लंबे समय तक चलता है। जस्ट डायबिटिक किडनी डिसीज बताने जाओ तो टाइप 1 डायबिटीज का कोर्स होता है कि मे बी 15-20 साल के बाद में आपको जब शुगर अनकंट्रोल रहती है तो आपको किडनी प्रॉब्लम चालू हो सकती है।
चालू हो सकती है।
एंड सबसे पहले रेटिना पे इन्वॉल्वमेंट होती है, फिर पेशाब में से प्रोटीन जाता है, फिर क्रिएटिन बढ़ता है। टाइप 2 डायबिटीज बहुत बार ऐसा होता है, लोगों का अवेयरनेस ना होना या फिर कॉम्प्लायंस विद मेडिसिन ना होना या फिर कोई हेल्थ चेकअप ना कराना, तो फिर वो सडनली डिटेक्ट होते, उस टाइम पे बाकी के और ज्यादा विलन्स जो है ब्लड प्रेशर एंड डिसलिपिडीमिया वो सब कुछ एक साथ आ जाते हैं। दैट मे लीड टू मोर कॉम्प्लिकेशन स्पेसिफिकली इन द टाइप 2 डायबिटीज। सो वी नीड टू अवेयर ऑफ दीज टू कंडीशन, टाइप 1 एंड टाइप 2। टाइप 1 इज लाइक अ इंडी मूवी विच इज यूजुअली बेटर क्रिटिकली एक्लेम, बट जिसमें ऑडियंस कम होता है। ठीक है, बट टाइप 2 इज लाइक अ ब्लॉकबस्टर मूवी हैविंग ह्यूज स्टार कास्ट लाइक हाउसफुल 5, but the problem is basically that it comes with lot of villains also.
Yeah.
So it has got more importance.
So what would be the symptoms that one should look out for?
First and foremost is that whenever you are a diabetic patient, we need to check swelling of the feet.
अच्छा।
Maybe early in the morning when you rise from your bed, you may notice some facial puffiness or
Facial puffiness.
swelling underneath your eyes.
हाँ,
You
हाँ।
may notice some foam in the urine.
अच्छा।
पेशाब में झाग आना चालू हो जाता है और पेशेंट
अच्छा।
बोलता है सर्फ एक्सेल जैसा झाग आना चालू हो गया है।
हाँ।
सो दीज आर द थिंग्स। मे बी यू मे गेट ब्रेथलेसनेस ऑन एक्सर्शन,
अच्छा।
ये हो सकता है।
अच्छा।
आपका एपेटाइट कम हो सकता है, मे बी आपका कॉन्सेंट्रेशन कम हो सकता है। डेफिनेटली मतलब ये मल्टीपल ये है, आपका यूरिन आउटपुट जो रेगुलर है वो रेगुलर इससे कम हो सकता है। सो दीज आर डिफरेंट फीचर्स, इट कैन स्टार्ट फ्रॉम हेड टू टो, any of the systems of the body may be involved when you develop diabetic kidney disease. There may be vision changes also. Yeah, please.
Okay, so मतलब इनके कुछ red flags है क्या? I mean, can we give some red flags to these patients?
Red flags is that I always urge all the doctors and patients, whenever they are diagnosed with diabetes, please check two things first. One is retina, that is presence of diabetic retinopathy is definitely an indicator of end organ damage.
Okay.
That is the first sign that usually a type 1 diabetic develops.
Okay.
And second red flag is basically your protein in the urine.
Okay.
Now, sugar in the urine is not that much important. It may be because of some uncontrolled, but protein in the urine definitely comes because of the
big red
multiple
sign.
factors. The last red flag is GFR, that is creatinine. For all average normal adults, the creatinine should be 0.7 to 1.3. Any patient having creatinine more than 1.3 or 1.4 and GFR less than 90 is a alarming sign.
So GFR definitely becomes a test which should be done by every diabetic patient annually once. Apart from that, protein in the urine, what would be the tests that would require for this?
See, whenever a type 1 diabetes is there, we recommend that retinopathy checkup should be done every 5 yearly,
five yearly
for 5
ones.
yearly
अच्छा
once, and
अच्छा.
your annual health checkup, जैसे आपका बर्थडे है या
हाँ
साल का पहला दिन है,
हाँ.
तो आप अपना पूरा हेल्थ चेकअप कराइए
I
उसमें.
remember you saying, I was
बर्थडे.
having, yes, yes, I was having a discussion with you, and you
Yes,
said, every birthday I gift myself a health checkup.
yes,
So that
yes,
was
yes.
so beautiful.
Yes, yes, that is needed. And for that is for type 1 diabetes every 5 yearly. But type 2 diabetes, unfortunately, it gets diagnosed late.
Hmm.
And because of which, at the time of diagnosis of type 2 diabetes, you
Hmm.
should check your eyes for
Hmm.
retinopathy, for proteinuria, and for creatinine.
Hmm.
Not only these things are important, the lipid, the sodium, potassium, bicarbonate, lot of other values are there that also needs to be checked.
So an annual check for all these parameters
Yes, yes,
would be safer bet if
yes.
you have diabetes.
See, we have car, we have got mobile, we have got cable, we have got everything. We do every monthly
Servicing,
recharge, servicing,
yeah,
everything.
correct.
We do everything for gadi, but we do nothing for a body.
That's well said. So in my previous interaction with other diabetologists
Huh.
and doctors, I've also understood that these diabetes medications, though they try to keep the sugar levels in check and things in control, they also contribute to certain level of weight gain.
Hmm.
Now, why I'm saying this is because every drug that we take eventually gets excreted out of the body, mostly through kidneys. So, do diabetes medications also have certain effects on kidneys?
See, I will say if you are having a normal kidney function, I think that is the best stage when all the diabetes medicine can be used.
Hmm.
Okay. And there are different categories of diabetes medicine. I think the diabetologist lectures will be much better. But moment you are diagnosed with a kidney disease, so according to there are 5 stages of kidney disease: 90, 60, 30, 40, 15, and less than 15. These are the 5 stages, and at different stages, as your kidney function declines, there are some of the diabetes medicines which are contraindicated. They need dose modification. जैसे अगर मैं बोलूँ, मोस्ट कॉमनली यूज मेडिसिन डायबिटीज का होता है मेटफॉर्मिन. तो अगर आपका किडनी फंक्शन 30 के नीचे है तो मेडिसिन नहीं लेना है. ठीक है, बहुत बार आपके जो रेगुलर डॉक्टर है वो अपने रेगुलर हेवी पेशेंट शेड्यूल में भूल सकते हैं. आपके हर रिपोर्ट में जब क्रिएटिनिन आएगा तो आपको क्लियरेंस कैलकुलेट करना है. तो ये कुछ अच्छे मेडिसिन है, बट किडनी फंक्शन जैसे डिटेक्ट होता है तो दे शुड नॉट बी यूज. बट ये कॉन्ट्राइंडिकेटेड. बट देर आर अदर मेडिसिन जैसे कुछ SGLT2 इनहिबिटर जो मार्केट में आए हैं, या फिर कुछ नए GLP-1 आए. बहुत सारे फिल्म एक्टर्स और लोग एकदम वेट लॉस कर रहे हैं. नया कुछ मेडिसिन आए हैं मार्केट में.
I believe those medicines are more used towards weight loss than
बट कैसा
controlling the
होता है
sugar
कि
levels.
moment you start these medicines, it may happen that you start these medicines and kidney function may decline, but that is a transient hemodynamic effect. वो
Okay.
medicines long run के लिए बहुत अच्छे होते हैं.
Okay.
Your physician, your doctor should be aware of it. And किस पर्टिकुलर GFR के बाद में, किडनी फंक्शन के बाद में उनको बंद करना होता है, वो आपका नेफ्रोलॉजिस्ट या आपका फिजिशियन उसको मॉडिफाई करेगा. जैसे कि इंसुलिन होता है, सब बोलते हैं सेफ है सेफ है, बट नहीं, कि जैसे इंसुलिन को किडनी तोड़ती है, तो मोमेंट योर किडनी फंक्शन डिक्लाइंस, इंसुलिन क्लियरेंस विल गो डाउन, एंड देयर विल बी अ वेरिएटिंग ब्लड शुगर लेवल्स एंड मोर रिस्क ऑफ हाइपोग्लाइसीमिया, स्पेशली विथ इंसुलिन and the sulfonylurea kind of drugs.
So we can conclude this by saying that yes, these medications do have an impact on the kidneys. So
Yes.
keep a close check on the parameters and all that
Yes.
stuff. Now coming to the lifestyle part of it,
Hmm.
how much role does a stress or lack of sleep or amnesia?
See, stress. I think, in other words, in today's IT world, Pune's ITC, and I will say कि in today's era, because of mobile, because of social media, no one is going outside. Everyone is at home and looking reels and social media and the contents and even AI. So everything is sedentary nowadays, because of which your activity is reduced. Second thing, stress. Everyone has got job stress, maybe your regular family stress, whatever it is, but it's called as a chronic fatigue syndrome. If you are not taking frequent breaks, then it will lead to chronic stress. Then second thing is poor sleep, that you uttered, but the poor sleep means that sleep duration less than 6 hours. And it happens with today's era that everyone is behind finances and making himself stable. But these two are basically the other non-glycemic contributors for the diabetic kidney disease. What they will do, they will increase your cortisol levels. By increasing the cortisol levels, they will increase your blood pressure, they will increase your blood sugar levels, they will alter your glomerular hemodynamics also, and that will lead to damage to the kidney glomerulus. and that's how they lead to damage to the kidneys also. So it's like the lifestyle, as you say, you are smoking alcohol, Friday night parties, Saturday night parties, not keeping of calories and everything. So smoking, alcohol, the other lifestyle, bad lifestyle, they all are the contributors to this, and that may lead to problems with CKD.
Okay. So, when we talk about diabetes and the kidney issues, so one impact which we discussed right now is directly diabetes leading to kidney issues. But as I said in the beginning of the podcast, that there are many diabetics who are not having the kidney issues because of diabetes, but that there is a kidney damage because of some other conditions, maybe. So, how do you differentiate between these two?
See, what happens, I will answer this question like, despite some patients may say मेरी शुगर तो नॉर्मल है,
हाँ जी.
तो भी किडनी प्रॉब्लम क्यों हो गया, एंड दूसरा और एक क्वेश्चन इसका हिडन क्वेश्चन है कि नॉन डायबिटिक किडनी डिसीज क्या है. तो आई विल आंसर फर्स्ट कि जिसके अंदर जैसे मतलब इवन इफ यू आर हैविंग नॉर्मल शुगर, इट डजंट मीन दैट यू विल नॉट डेवलप किडनी डिसीज. देयर इज अ कंडीशन कॉल्ड एज जेनेटिक familial conditions, जैसे रास जीन पॉलीमॉर्फिज्म या HP एक्सिस डिस्टर्बेंसेस, दे ऑल मे लीड टू जेनेटिक इश्यूज. एंड डिस्पाइट अगर आप आपको फैमिलियल कंडीशन है, जेनेटिक प्रॉब्लम है, माइनर rise in sugar levels, so moderate fluctuations in the sugar levels may lead to early kidney injury, and that's why you develop kidney disease. Second biggest player is blood pressure. So if you are having normal sugar but uncontrolled blood pressure, so that again may lead to problems with proteinuria, may lead to eye damage also. So majority of the people's blood pressure dips at night. So your daytime blood pressure is different, nighttime blood pressure is different.
Yes.
And that night dipping, when it is absent and higher masked hypertension is there, so in such cases also it will lead to kidney injury.
अच्छा.
थर्ड थिंग मे बी लीगेसी इफेक्ट. सपोज पहले जब डायबिटीज डिटेक्ट नहीं हुआ, उस टाइम पे आपके शुगर्स अनकंट्रोल थे, उसकी वजह से आपके किडनीज को या ग्लोमेरुलस को इंजरी हो गई है, सो उसके कारण भी बाद में भले आपके शुगर्स नॉर्मल हो, सो दैट्स कॉल्ड एज अ लीगेसी इफेक्ट और मेमोरी इफेक्ट, दैट मे आल्सो लीड टू किडनी इंजरी. एंड लॉट ऑफ टाइम्स प्रोटीनूरिया. सो बिफोर किडनी डैमेज हैपेंस, आपके पेशाब में से प्रोटीन जाना चालू होता है, मतलब क्रिएटिन बढ़ने से पहले. सो दैट मे बी अ कंडीशन वेयर यू विल से मेरा तो क्रिएटिन नॉर्मल है एंड माय शुगर्स आर नॉर्मल, and still why I am getting diabetic kidney disease. So it's a mixture of all these, I can say, inflammation, hemodynamic,
so
blood
deadly
pressure,
combination,
genetic, all the deadly combination leading to this disease. Now to answer the second question, non-diabetic kidney disease. There is a study research done in USA where they have seen that all the diabetic patients whose creatinine was increased, they diagnosed them 30 to 40% ऑफ द पेशेंट इज नॉन डायबिटिक किडनी डिसीज. मतलब हर डायबिटीज पेशेंट जिसका क्रिएटिन या किडनी फंक्शन डिरेंज होता है, वो हमेशा डायबिटीज कारण नहीं है. तो 30 to 40% कंडीशन ऐसी है जो आप रिवर्स कर सकते हो, या उनका कारण अलग हो सकता है. जैसे मैंने हाइपरटेंशन बोला, ब्लड प्रेशर वगैरह है, बट साथ में कुछ ऑटोइम्यून डिसीजेस होते हैं कि जो आपको क्रिएटिन बढ़ा सकते हैं. जैसे किडनी के अगेंस्ट एंटीबॉडी बनती है, कोरोना में एंटीबॉडी सबको पता है. सो दैट मे बी अ कॉज ऑफ डायबिटिक किडनी डिसीज, जो आपको ब्लड टेस्ट, यूरिन टेस्ट, मॉनिटरिंग, इमेजिंग, एंड फॉर अस इट इज द बायोप्सी. अगर हम सस्पेक्ट कब करेंगे, जब किसी को सडनली प्रोटीनूरिया होता है या सडनली बहुत ज्यादा बढ़ जाता है. नॉर्मली 100 मिलीग्राम एक दिन में प्रोटीन 100 से 200 जाता है, बट अचानक 2 से 3,000 मिलीग्राम के ऊपर जाना, क्रिएटिन का अचानक बढ़ जाना, टाइप 1 डायबिटीज के किसी को बिना रेटिनोपैथी के सडनली किडनी का प्रॉब्लम होना. सो ये कुछ कंडीशंस है जिसके अंदर हम यूजुअली किडनी बायोप्सी करते हैं. वो भी पॉसिबल नहीं तो हम कुछ लैब वर्कअप करते हैं. सो व्हेनेवर इट इज सस्पेक्टेड, प्लीज refer your patient to the nephrologist so that this can be diagnosed and your disease can be reversed. Like I got a lady whose creatinine was almost 22, almost referred to me for a very high creatinine, almost like renal transplant. The family was scared. We did dialysis, almost 8 to 10 sessions were done. Finally I did a biopsy, found out to be damaged because of blood pressure. Fortunately everything was managed, creatinine turned out to be 1, and I am managing her since last 15 years.
So from dialysis you brought
Yes.
it back to
Yes,
normal,
yes.
being
So-
normal. So is there something called as, when it comes to saving the kidneys, is there anything called as too late?
See, too late.
Too late to reverse the damage caused?
My one word to use that, what nephrologists are having, whenever anyone thinks बस ये भाई dialysis वाला है, transplant करने वाला डॉक्टर है. So the thing is that we can prevent, or at least we can treat, or we can delay that progression. So everyone nowadays, everyone knows about dialysis and kidney transplant. Even there is a joke that नया एप्पल फोन मार्केट में आ गया और मैं अपनी किडनी बेच के मैं एप्पल फोन
लेके
खरीदूंगा.
आया.
इतना मतलब that is इतनी ज्यादा अवेयरनेस है पब्लिक में कि किडनी ट्रांसप्लांट भी एक चीज होती है. नहीं, ऐसा नहीं है. आपके डॉक्टर जो फिजिशियन है एंडोक्राइनोलॉजिस्ट, डाइटिशियन, नेफ्रोलॉजिस्ट, ये हम सब मिलके जो भी कंडीशन है, अगर आपका जीएफआर, मैंने जो 5 कंडीशन बोले, एट व्हाटएवर कंडीशंस यू कम टू अस, वी विल मैनेज इट. देयर इज अ टर्मिनोलॉजी कॉल्ड एज रेसिडुअल किडनी फंक्शन. मतलब
Okay.
आपके किडनी का फंक्शन जितना बचा है, उसको हम पर्टिकुलर डाइट मॉडिफिकेशंस करके, पर्टिकुलर आपको वाटर इनटेक या फ्लूइड इनटेक मैनेज करके,
Hmm.
एंड शुगर, ब्लड प्रेशर सब कुछ मैनेज करके हम
Hmm.
आपका डायबिटिक किडनी डिसीज का जो प्रोग्रेशन फास्ट हो रहा है,
Hmm.
उसको कम कर सकते हैं.
Hmm.
लाइक टिल द एज ऑफ 40 आपका जीएफआर स्टेबल रहता है,
Hmm.
बट 40 के बाद में एजिंग इफेक्ट चालू होता है. जैसे
Hmm.
क्रिकेट में से भी रिटायर कर देते हैं आपको,
Hmm.
तेंदुलकर हो, धोनी हो,
Hmm.
सेम थिंग आपका 40 के बाद में जीएफआर या 50 के बाद में जीएफआर 1 ml पर मिनट पर ईयर डिक्लाइन होता है.
अच्छा.
जैसे ही आपको साथ में एडेड बोनस मिलने लगते हैं, डायबिटीज, ब्लड प्रेशर, या फिर अगर वो उसके साथ में आपका 2 ml पर मिनट जाएगा,
Hmm.
डीकेडी हो गया या क्रिएटिन बढ़ गया,
Hmm.
वो 5 to 10 ml पर मिनट पर ईयर जाएगा, तो आप बहुत
Okay.
जल्दी डायलिसिस
So
पे आ
it
जाओगे.
basically worsens.
Now in today's era, what is happening? Life expectancy is rising.
Hmm.
You are asking for the cardiologist, वो प्लास्टिक करते हैं,
Hmm.
ऑनको एडवांस हो गया है, सो फ्रॉम कम्युनिकेबल वी आर गोइंग टू नॉन कम्युनिकेबल.
Hmm.
तो सब कुछ हो जाता है. नाउ बिकॉज ऑफ इंक्रीज लाइफ एक्सपेक्टेंसी,
Hmm.
people are getting more and more life expectancy, and you are getting diagnosed with CKD.
So it is eventually landing up there.
Yes.
Okay, so moving on to the next segment of this podcast, which is a rapid fire round. And my personal favorite one, I must say. Most of these questions are something which I have already asked you, but I would want you to give a one liner or a crisp answer. So what's one question you wish every diabetic patient asked their doctor about kidney health, but they usually don't?
Hey, I wish that every patient should ask me how I can prevent my kidney damage, or if I am spilling protein in urine, how I can prevent it, and what is my GFR level. These are the question I expect from a patient.
Okay, so what's more concerning, a sudden rise in creatinine or a sudden decline in eGFR?
Sudden rise in creatinine is like a fire alarm. Okay, so I will say that it's an acute condition. You need to address it immediately, and it may be because of infection, sepsis, medication, obstruction. So we need to look at it differently, and it is an acute condition, and it may be reversible. Gradual fall in GFR, as we are discussing about the diabetic kidney disease,
Which
it's a
is
slow, which is
eventually
eventual. It happens slowly,
over an
and
age.
there are multiple factors that we need to address. So it's a chronic condition. First one is acute. So the gradual fall is like a fuse which is burning over a period of time.
Okay. So what's one symptom of kidney damage which in diabetes? I mean, one symptom which should not go unnoticed of kidney damage in diabetes.
Protein in the urine.
Protein.
That is albuminuria, to be specific.
Okay, I've already asked you this, but I'll still ask you again. All diabetic kidneys, a test which all diabetic patients should get for a healthy kidney.
See, we all follow the international KDIGO guideline, which
Okay.
defines a diabetic kidney disease into 5 stages. They are all based on 2 parameters. One is proteinuria, that is albuminuria. 3 categories, A1, A2, A3, and the second is eGFR. So, creatinine and urine protein creatinine, urine albumin creatinine ratio. These are the 2 tests. They are must. Along with that, I will say BSL, your HbA1c, your sodium, potassium, micron, and other tests are also important.
Which is worse, a painkiller effect on the kidney or protein supplement effect on the kidney?
See, painkillers short term, I think it may be okay if your creatinine is okay. But my personal suggestion: do not take painkillers or over the counter medicines without doctor's advice. Always check your kidney function. And some of the painkillers are even banned in India also. So please take painkillers with doctor's advice. As in US, they are not allowed to give any medicines without prescription. But in India, over the counter
we get over the
medicines are
counter
available.
everything.
About protein, it differs. Basically, there are 2 types of protein: plant-based and the whey-based protein. And like if you develop kidney disease, we will advise you to go on a low protein diet. Suppose you are in early stage, it will be 0.8 to 1 gram per day per kg per day, and in advanced stage of kidney disease, we will advise you 0.6 to 0.8 gram per kg per day. For normal person, for normal population, it is 1 to 1.2 gram per kg per day is the normal average protein intake.
90% of kidney function can be damaged before the symptoms show up.
See, it is common that, for the creatinine to rise, almost 50% of the kidney function may be damaged. And for almost, it is a silent disease. That's why it has got the more importance nowadays, that you may lose your 90% of kidney function before you develop symptoms like swelling, breathlessness, and other decreased appetite. It is true. It's true.
Okay.
Yes.
What's more dangerous for your kidneys, high sugar or high blood pressure?
I will go on high blood pressure because high blood pressure is very dangerous. Sugar will damage your kidneys over period of time, but high blood pressure is worse. It may damage heart, kidneys, and everything.
Mhm. Is swelling in your feet always a sign of kidney trouble or just a poor circulation?
See, edema, majorly the people are coming to you for swelling of the feet, and good that the people are aware of the swelling of the feet may be caused by kidneys also. But I will give the five examples. It as it is rapid fire, but still heart failure, maybe any heart condition, low hemoglobin, thyroid, liver issue, maybe because of alcohol, and last is the maybe your rising creatinine,
Mhm.
low kidney function, and the
Mhm.
protein in the kidney. These are
Mm.
all reasons for your pedal edema.
Which is the biggest enemy, sugar or salt for kidney?
At present, first both are dangerous, but
Acha.
salt is more dangerous than because it is
Oh,
less
salt is
addressed.
more
The
dangerous.
problem is that Indian diet is very high in salt. You go to other
Acha.
countries, they will give you less salt in the diet also.
Yeah.
So first I will go with salt, then followed by sugar.
Okay. Is this also in the Indian context? I'm saying, खाने में ऊपर से नमक लेना. Is it actually harmful? I
It's
mean, is there a difference कि मतलब खाने में बनाते वक्त नमक ज्यादा डालना
hmm.
या ऊपर से एडिशनल टेबल सॉल्ट लेना?
No, just as a layman's language, I will say one pinch is 1 gram, roughly. I will say,
हाँ
okay. So in a day, you should not go more than 3 to 4 pinches of salt in a day.
हाँ
उसके
हाँ
ऊपर नमक मत खाइए.
हाँ हाँ.
हमारा इंडियन डाइट में एवरेज इस मसाले होते हैं, बहुत सारी चीजें होती हैं, तो मे गो टू 5 to 8 grams.
हाँ हाँ.
So the average recommended sodium intake is 2 grams per day, 2 to 3 grams per day, especially when you are diabetic or hypertensive.
Mm-hmm.
Please do not put extra salt in the diet.
Okay.
Avoid it.
Now, for general public, additional salt, does it actually
Better to avoid.
better to avoid?
Why to take? Huh? Especially if you are diagnosed with any conditions like diabetic hypertension, and it's a preventable thing.
Uh-huh.
There are many film actors who have not taken sugar for many years.
Yeah, because all this while I believed that sugar is the real culprit, looks like
Yes,
salt is also one of the
sugar is one
culprits
of the
now.
poisons, I will
Poisons,
suggest.
yes. One food that diabetic kidney patients should be very cautious about.
I will suggest protein in the urine.
Achha.
That is most important.
In one line, what's your golden rule when it comes to protecting the kidneys in diabetes?
It's I will suggest that diagnosis should be early.
Mm-hmm.
To do the diagnosis, you should you do your health checkup regularly.
Mm-hmm.
Once you're diagnosed, you should be managed thoroughly.
Mm-hmm.
This is my golden rule.
Okay.
Yeah.
Now, lastly, we want to hear some case from you, which has been very close to your heart and which has, given you a lot of happiness while treating the patient.
I will say two, but still, I will. There is one lawyer who
Uh-huh.
came to me and on his health checkup,
Uh-huh.
he was aware of the health checkup, so he did his health checkup, and we found that his kidney reports were normal,
Acha.
but he was losing protein in the urine. So because of which, what has happened? I recommended after all thorough workup that he needs a kidney biopsy. He was non-diabetic, but BP was on the higher side, and eye function was normal. बट ही वॉज क्वाइट रिलक्टेंट. उसका कहना था कि नहीं कि बाकी अदर गूगल है आजकल तो लोग गूगल पढ़ के आते हैं. सो ही सेड नहीं नहीं, देयर आर सम अदर रीजन, फिजियोलॉजिकल रीजन से जिसके कारण मेरा प्रोटीन जा रहा है, एंड ही निग्लेक्टेड.
So he didn't go for the
he didn't
biopsy.
go for the biopsy.
Achha.
Unfortunately, he met me after 6 months, and after that he was on dialysis.
Oh.
Then again we investigated, we took the risk, we did the biopsy. On biopsy, we found a condition called as IgA nephropathy. That
And
IgA nephropathy.
What is that IgA nephropathy?
IgA nephropathy means formation of antibodies against your glomerulus, against your kidney.
So you're saying that if he had done the biopsy on time, this could have been avoided.
Yes. IgA nephropathy is a treatable condition, and at earlier stage there are a lot of treatment options are available nowadays. So once we diagnose it, we do all the tests and we give the medicines.
Mhm.
But if we allow the protein and blood pressure to go on in the same way, then definitely the kidneys will be failed. And unfortunately, on biopsy, even though the condition was IgA nephropathy, he neglected. He never took any medicines, and because of which he went on dialysis. And the report was like his kidneys were burnt out. Then we have to start him on dialysis. But fortunately, at that time, he and his family members, they all cooperated. That patient underwent a kidney transplant. आज भी उस किडनी ट्रांसप्लांट सक्सेसफुल हुआ, फादर ने किडनी डोनेट की है, एंड ही इज डूइंग गुड एंड ही हैज जॉइन्ड हिज ड्यूटीज.
I think this case also, throws a lot of light on the fact that, not to disrespect anybody, but then being from an educated background, also many of us take many instructions from the doctors very lightly.
Yes.
I mean, it gives me chills to think that one kidney biopsy would have saved
Yes.
him from getting a kidney transplant done.
Yes.
So I think it's a big message out there to public also, that when a doctor is telling you to get some tests done, get it done. You never know where it lands up. On that note, we thank you once again
Thank you, madam.
for coming to Sahyadri Health Talks. It was a wonderful discussion. We have it, had it with you, and we look forward to having you again on this podcast channel. Until then, thank you so much. Thanks
Thank
for
you.
coming.
Thank you, madam. Thank
This
you.
is Dr. Tushita signing off, Sahyadri Health Talks.